Perfect. Huge thanks and kudos to the three presenters from earlier this morning. They were all wonderful presentations. So for this part of the morning, I just want to give you a bit of a taste of some of the research that's ongoing here in Edmonton in collaboration with colleagues at different sites across the country. For example, we're really excited to be working with Jessica Bryan on the Social ABC's research program. She did an incredible job of talking about the evolution of that program and the impact that it's making on young people and families. So we're really proud to be part of that. We'll give a bit of a taste of other research that's happening through the sibling study that Jessica talked about, as well as some of the other longitudinal research, talk a little bit about other new projects that we're excited to be starting in the next year. And I'm also really pleased to just acknowledge what a team effort this is. And I feel very privileged to be working with two amazing graduate students who, Grant Bruno and Nicholas Piroddi, who will be presenting on the research that they're doing as part of the autism community here in Edmonton and in the province. Sorry. Figure out how to fix it. It doesn't. Oh, there we go. So honestly, it was such an honor to be able to have greetings from the Stollery Foundation, and sort of one of our updates is that the endowed chair in autism research was actually renewed in the past year. So that provides ongoing support to the collective work of the center, as well as giving us flexibility to support trainees and community events such as this one. So we're incredibly grateful to the foundation, and that will kind of keep this work going for another few years as we continue to kind of seek for resources to continue. So a couple brief findings from the infant sibling study. So Jessica did a terrific job of explaining the nature of this research program. So essentially knowing that autism can run in families, so that the likelihood of autism is a bit higher in brothers and sisters of autistic individuals than in the general community. By working with infant siblings, it's an opportunity to work with a group of infants that has kind of a spectrum of developmental differences and a higher rate of autism, probably about 20%. So a chance to work with autistic people, before they would be identified and referred from the community, and that is to see some of the earliest features of autism, even in infancy. So the first study I wanted to highlight was led by a colleague, Martina Francini, who was a research trainee with our colleagues in Halifax, is currently on faculty in Switzerland. And she did a really nice job of sort of looking at the data that we have available. As Jess alluded to, we've been working with families for over 20 years now. Some of the participants have actually reached their teens. I mean, as an aside, Lori is actually leading a grant application to give us an opportunity to circle back to some of those individuals that we've gotten to know as infants and toddlers and are now kind of in their older teens, to kind of understand what's happening in their life right now, sort of how they see sort of research fitting in terms of sort of understanding their needs and the continuity to what we learned about what life was like for them when they were infants and toddlers and through childhood. So that would be wonderful to see move forward. This particular study looked at the continuity of features from infancy, so starting at 6 months all the way up to 7 years in the Canadian group of 500 individuals who had participated to that point. So the main finding there was that even though there's a lot of diversity in features among autistic children, and including some of those children who weren't actually diagnosed during the school age years, there was actually continuity to sort of what some of those features were early in life. So even those children who weren't diagnosed until they hit the school system, looking back, there were actually some subtle features even during infancy. And it kind of really sort of gives us a unique window into looking at what those features are, and to work with the clinical community to ensure that that group of individuals that often flies under the radar early in life, what should families and clinicians be looking for to ensure that they are diagnosed earlier and can potentially benefit from earlier supports and services. The second study is a study and a paper that Lori led that was specifically looking at emotional regulation, and that is kind of observable features as well as physiologic features as infants participated in a series of activities some that were kind of not very exciting, and some that were designed to be sort of fun and elicit positive reactions, like seeing bubbles, and some that were kind of mildly frustrating, like having a toy taken away from them. So there was a group of infant siblings, so infants who had an older brother or sister with autism, and also a group of infants who didn't have a family history of autism. So Lori reminded me, this is actually not her youngest child, but actually Ava, who I think is 7 or 8 now. So kind of speaks to sort of how long this work has been going. It's just sort of a brief illustration of what these activities look like. So essentially, Lori or Sana or one of the other leaders, there's Sana as well, worked, sat down with the parent and infant and worked through those activities, and again sort of looked at the emotional responses to different activities, some that were kind of fun and pleasant and some that were a bit unpleasant. So the bottom line is that those infants who went on to develop a diagnosis of autism, even during infancy, did show differences in emotional expression. They showed stronger expression of negative emotion during frustrating tasks like having a toy removed. Interestingly, a tendency to kind of look longer or get a bit stuck on some of the neutral activities. So difficulty kind of shifting attention, which may also kind of link to their ability to kind of shift their emotional feelings. And interestingly, not only were there observable features of emotional differences, but also a difference in their heart rate response. And our motivation for looking at that was sort of earlier research that suggested that there are some autistic individuals that may be experiencing significant distress, but it may not be it may not be obvious to others around them, because their expression of facial emotion may not be exactly what people would expect among non-autistic individuals, and yet their inner experience, including the physiologic experience of emotion, was different. Our thought here is that knowing that individuals who go on to develop a diagnosis of autism are already showing differences in their internal experience as well as sort of outward experience of emotional expression. How can we incorporate those insights into programs like the social ABCs to empower families and support infants and toddlers in kind of navigating those negative emotional experiences? The next paper I'll highlight is from our Pathways in Autism study. This is a study that's also been ongoing for about 20 years. Essentially, it's a number of sites across the country invite families whose children have just been diagnosed with autism during the preschool years, and then we follow them kind of at regular intervals over a period of time, and in fact, all the way through adolescence now. We're at a bit of a crossroads with this study in terms of thinking about what are the important things to continue to, what are the important questions that we might address sort of among this group of individuals, where we've gotten to know them over time and sort of understand their life history. What are the important things to study as they reach adulthood? As part of that, I worked with a group of colleagues, including Pat Miranda, who's an expert in augmentative communication methods at UBC, as well as some colleagues in Montreal, to kind of develop methods of sort of tapping into lived experience among autistic youth, sort of across the spectrum of developmental ability, including individuals who were minimally verbal, and try to come up with a common set of strategies so that we could understand sort of a bit more about their experiences, their priorities, and ultimately to help inform sort of the next stage for this research. So this is sort of one of the results of this general effort. And first of all, under Pat's leadership, we incorporated kind of communication strategies to come up with a standard way of asking the youth on the autism spectrum sort of about their experiences. And it was the team who implemented this found that sort of providing some of the structure and the visuals was helpful not only for those that were minimally verbal, but also for those who were verbal communicators, but under sort of a stressful and unfamiliar situation of interacting with a new interviewer, actually found that some of the visual prompts helpful as well. And you can read the themes that came out here, but I think it really illustrates the richness of the lives of autistic youth across the spectrum, the issues that they're grappling with, kind of like other, kind of as with other youth in terms of looking towards the future, seeking social connections, thinking about independence, sort of how they experience the school system and sort of their emotional lives. And really sort of with their insights and leadership, that's helping us formulate some questions for the next phase of the study. This is a paper I wanted to briefly highlight, just not specifically related to one of our studies, but just something that I'm really proud to have been part of, and really excited to work with a group of colleagues, including Heather Brown, who's a professor here in educational psychology at the University of Alberta. Autism Science Foundation actually brought together a number of interested clinicians, autistic people, and researchers to kind of grapple with the issue of the unique experiences of individuals assigned female at birth, and sort of how that influences the expression and experiences related to autism. Initially the group was focused on differences in early detection and diagnosis, but the conversation quickly went to experiences across the lifespan. And you can see some of the key points here related to diagnosis, that just recognizing that there are some disparities in identification. Although in general, boys, individuals assigned male at birth are identified and diagnosed 3 or 4 times more commonly than those assigned female at birth, there's increasing evidence that there may be under-identification of females, I think, for a combination of genuine subtle differences in sort of clinical expression, but more to the point, sort of differences related in expectation and biases among clinicians, and sort of just general barriers in the system that was largely designed for a condition where there was a perception that it was predominantly boys and men. And it includes a lot of sort of helpful recommendations, both to be respectful of and sensitive to those differences in experience, and some specific recommendations for the clinical system. All right, so briefly, very briefly, I'll talk about, oh, okay, great. So a few new projects. So inspired by the infant siblings work, we're working with a few other sites in the US to actually kind of take a next step of working with infants who have not an autistic sibling, but actually an autistic aunt or uncle. So essentially, this is kind of the generation of families where, it might have actually been a younger sibling that we worked with in our original sibling study. They're grown up, they're now having their own families and starting to have children, kind of asking questions about sort of knowing that they have an autistic sibling themselves. What should they be monitoring for? What's the likelihood of having an infant who's ultimately diagnosed with autism? And on a small scale to get started, to actually start to examine these questions, and at the same time better understand how to provide these kinds of supports to families that have an autistic individual in the extended families. How do we ask the right questions? What sort of additional monitoring can we embed into general healthcare and into the developmental service system? And in general, kind of what are the unique needs of these families, and at the same time, sort of how does the unique experiences of someone who's grown up with an autistic sibling, sort of how does that impact on their parenting, including parenting a child who themselves may be increased likelihood for autism. The pediatric autism research cohort is being led out of McMaster University. It's a bit of a Pathways 2.0, sort of drawing on the lessons of that original study of newly diagnosed autistic preschoolers, and trying to scale it up in a way that makes it a bit more accessible. So the number of families that can participate can be larger, that it can be implemented outside of kind of large urban centers and large academic centers. One of the specific strategies is to move some of the assessment to mostly online, so that families can participate without necessarily having to bring their children into a specialized clinic, or essentially participate from home. And there's also a focus on generating reports based on those research measures in a way that's meaningful to families, and perhaps kind of provide some practical information for clinicians working with those children. So that is, the group at McMaster have been working on this for a few years, and we're excited to be starting up a site of the study here in Edmonton, under the direction of Sana. I just want to acknowledge some of the community partnership work that we're doing, with the support of a particular telehealth community of practice approach called Extension of Community Health Outcomes, or ECHO. This is essentially kind of bringing together a group of interested colleagues online on a Zoom, kind of like we are today. Creating a partnership between a specialty team at a traditional clinic like at the Glenrose, and reaching out to people working in the community, in private practices and group practices, or in remote kind of areas outside of the specialized center, to be working on a common goal, whether that's supporting autism diagnosis, whether that's supporting better healthcare for autism. We're excited to be collaborating with actually Jessica and a colleague of Jessica's, Melanie Penner, who's a developmental pediatrician at Bloorview in Toronto, who's leading this national study to evaluate this ECHO method in a more intensive way. How does it empower professionals to provide better care? What is the direct impact in terms of sort of their work with families by sort of directly auditing some of those charts? And working with the broader community, including representatives from each site that bring experience through their diversity as well as autistic experience to better focus this program. And with that, unfortunately, I've left a little bit of time. I'm really delighted to introduce and welcome Grant Bruno, who's a PhD student who will talk a little bit about his work. And then after Grant presents, we'll introduce Nicholas. Thanks, Grant.
Thank you, Lonnie. Yeah, Tanse, Grant Bruno, Natsigatsen, Musqueam, Chinia. Hello, everybody. My name is Grant Bruno. I'm from Musqueam, which is a First Nations community located about an hour south of Edmonton. I'm a parent. I have 4 children, 2 of which are autistic, and I'm a PhD candidate in medical sciences in the Department of Pediatrics under the supervision of Lonnie Zwaigenbaum and David Nicholas. And today I'm going to talk just a little bit about my project and how it came to be. So one thing that we try and do in the community as much as we can is we try and bring as much culture into everything we do. So there's a term we would use, Nehiawatsun, and that's, Cree language, concepts, worldview, and that's woven throughout all of my research. And so I try and, leverage elders' expertise and community members and bring in as much of the culture as I can, because one thing that I've learned is that when you have culture as foundation within our communities, when we think about SLPs and O2s, and that's something I do with my own children, is you're going to get much better results. You're going to build connection, and that connection is going to allow you to do the work you want to do. And so there's a Cree legal tradition called Wet'suwet'en, and Wet'suwet'en is really the law of relationships and the connection you build within those relationships. And so my research is very relational. A lot of research, unfortunately, can be extractive, where you expect something for nothing, and that's not an approach that I'm comfortable with. And so in a second, I'll talk about my ability to give back to the community through my roles. And so really working with different community partners. So right now, I work primarily with Musqueam Education School Commission in the community, so the education system. But I also was able to, through the Canadian Autism Alliance, get a fellowship so I could expand my work to the 6 nations of the Grand River. And I work with the child and youth health team over there. So we're really trying to develop things at the different intersections autism happens, because as we all know, autism fits in everywhere, but it also doesn't fit in everywhere. So in the community of Musqueam, we actually started a monthly autism advisory circle. So this is made up of elders, educators, healthcare providers, and autistic people and all of their supports. So all of my research actually flows through them. So I don't actually make any big decisions myself. I come up with the ideas, we bring them to the circle, then we discuss. And again, just trying to think about how to make sure we can give back. I'm just going to move this for a second. So sensory teepee, we did this over at the Samson Cree Nation powwow. It was in collaboration with Autism Edmonton, who's gone now. But we actually have this sensory teepee outfitted with sensory items, and we're thinking about making it bigger next year, actually. So we're thinking about doing 2 teepees, one for the adolescents and adults, and then one for the kids and the toddlers, and trying to make sure that you're not only building awareness in the community about autism, but you're providing spaces for them to feel safe and feel welcome, and addressing that stigma. We actually did 2 documentaries. So I'm going to share a link in a second about one. I'm currently filming a full-length feature documentary with me and my son. It's called Sewatsu, which means they are sacred. And that's how we view autistic people, as sacred people, as beautiful people who need to be supported. And then I'm supporting 2 different autism clinics in the community too, which have both sprung up just from the community conversations we do. So we have a local community pediatrician who's doing amazing work. And we also have a clinic that started up in the education system. Okay, so the first study that I was able to do was a scoping review. This was Indigenous Peoples Canada and Autism. And what we did was we used Arksy and O'Malley scoping review framework, and we found 24 articles or 24 records, 15 of which were peer reviewed, 4 of which were considered good quality according to the Indigenous Quality Assessment Tool. That is a low, scary amount. And when you think about the National Autism Strategy and what they want to use as evidence base, there's virtually nothing. And so really hoping that my research gets out there and it's able to inform some of this. And it really showed the critical need for Indigenous-led research. And that's what my research is. Now, that's what makes my research very unique. It's community-led. It has myself from the community, and it's all benefiting back to the community, right? So really trying to figure out how do we make sure we're doing good work in the community. I'm also currently doing a traditional understandings of autism study. So I've currently interviewed 12 elders, and early findings include seeing autism as a gift, unconditional acceptance, traditional parenting impacts of colonialism. So the elders really, they understand autism, and we're coming up with a word up for it actually. And so we're just trying to figure out how to make sure we're addressing, again, the stigma, the medical model, and all these different things that are happening. And the third study, this is one is done in partnership with the Six Nations, is really exploring and engaging with parents and caregivers. And what we found so far is that cultural and kinship supports are huge. And unfortunately, the jurisdictional disputes that we find in our communities, because we're federal, reserves are under federal jurisdiction, and provincials where most of the services are housed, there's a lot of fighting in between the two. And so families often have to choose their kinship supports or their cultural supports or OTSLPs. And so really trying to figure out how do we bring it all together and make sure that, the parents are getting supported, because one thing I tell people all the time, if the parents are doing good, the children are doing good. Finally, if you have your phones out, I'm going to share a QR code to a short documentary that me and my son were able to do. This is me braiding my son's hair. And so I got to move this again. Yeah. And so this will bring you to an organization called Aid Canada. It's a national organization. They partnered with myself and David Nicholas, and we were able to do this. Only 18 minutes. It is a free documentary. Please watch it. Please share it with your families. There's a lot of valuable information in here. Thank you.
Thanks so much, Grant. I just want to introduce Nicholas, who'll be talking a little bit about his graduate work as well.
Thank you so much. So I'm Nicholas Piroddi. Most of you guys saw me at the table there. Greeting you guys. So my project is on residency training in autism care. So previous Canadian studies have indicated that pediatricians continue to miss cases of autism due to a lack of assessment, screening tools, effectiveness in tools, and lack of knowledge. And I kind of noticed this in 2 occasions. The first was when I gave a presentation to first-year residents in January. The knowledge that they knew about autism was very minimal. And then also in the last winter, I did some community pediatrician interviews as part of the ACNet. And again, the amount that they knew about autism, despite being pediatricians, was pretty minimal. And so I went to the literature, and surprisingly, I shouldn't say I'm not surprised, but there's no literature in the evaluation of autism in medical education in Canada in the field of pediatrics. And I do believe that in order to make systematic change in this, we should be looking at the education system, because how can we change things in the community if people are not being educated? So my study aims to inform curriculum development for pediatric training in Western Canada, and ultimately throughout all of Canada as well, but you can only do so much in 2 years, to best support clinical practice that improves quality of life for autistic children. So my primary research questions are: what are the current learning needs of pediatric residents with regards to autism care and potential areas of improvement? And also, what are residents' perspectives on providing best practice care to autistic patients, including their role? Because sometimes I've noticed that the pediatricians aren't sure what their roles are on the team. So my research design is an exploratory qualitative interview study. They're semi-structured interviews with residents in Alberta, so that's through University of Alberta and University of Calgary, and also British Columbia, so University of British Columbia medical schools, using interpretive description as a thematic analysis approach. Now, interpretive description started out in nursing, but it's being used in medical education. And the reason that I'm using that approach is because I want to best capture the lived experience of not only individuals with autism and their families, but also the doctors and the residents, because their perspectives on what they've learned is very important in order to make change. So I'm just kind of starting the data analysis now. But I will kind of share the initial data analysis with the emergent themes captured so far. And there's kind of 4 big themes that I found. One of them is that best practice care for autism is not well defined, and clarity is needed to understand how to best accommodate the needs of autistic patients. The second is communication with families and allied healthcare professionals is essential, but there's no skill development in the area. It's often overlooked in medical training regarding autism care. There's such a focus on diagnostic care, not so much that long-term and communication piece. And speaking of lack of education, there's lack of education regarding resources, standardized assessments, and the community roles impact residents' comfort with diagnosis of autism. And finally, there's a perceived limited gap on resources for residents. So there is interest in the residents to learn more about autism, but they're not quite sure where to look. So that's kind of the themes that I've come up with so far, and I will continue to look, and hopefully I can come back next year and share more with you guys. Thank you.